So hello everyone. So today we'll understand the various hematological changes in pregnancy. So as we know, in pregnancy there is increased demand. So there is increased blood supply to the fetus. So first we understand the various increase in the blood flow. So there is increased uterine blood flow from 50 ml per minute. There is increase to 500 ml per minute. So there is also increase in the uteroplacental blood flow. So it increases to 750 ml per minute, which is maximum at 32 weeks. Next, we'll understand that when there is increase in the blood supply, so there will be increase in the oxygen supply to the fetus. So in order to increase the blood flow, so there should be decrease in the blood viscosity in order to enhance the increased blood flow to the fetus. So what happens, there is decrease in the viscosity. So what happens is that there is various increase in the blood volumes. So the net blood volume increases by how much? The net blood volume increases by 30 to 40%. The plasma volume increases by 40 to 50%, and the RBC volume increases by 20 to 30%. So what happens? The plasma volume is increased more in compared to the blood cell volume. Therefore, there will be decreased in the hematocrit value. There will be hemodilution, which means that there is increase in the fluidity content of the blood because of the reason that is plasma is increased more in compared to the blood cells. So next we'll understand that what is hematocrit. It is also called as the packed cell volume. So it is a ratio of the volume of the blood cells by ratio of the plasma cells. So as we know, the plasma volume increases more in compared to the blood cells. Therefore, the hematocrit value reduces. So therefore what happens? So therefore there will be apparent fall in the hemoglobin concentration as compared to the hemoglobin mass. So there will be, though there is increase in the hemoglobin mass, but there will be apparent fall in the hemoglobin concentration. So next we'll understand the various changes in the different parts of blood, that is the WBC. Now what happens to the WBC cells? So there will be leukocytosis. So you can't differentiate it from infection. So in platelet there will be mild thrombocytopenia. The platelet numbers reduces. Next, what happens to the coagulation factors? All the coagulation factors rises except in the factor number 11 and factor 13. So as we know, pregnancy is a hypercoagulable state, which we'll understand in the next subsequent videos. Next we understand what happens to the fibrinogen amount. So the fibrinogen level increases to twice the value. So from 200 to 400 milligram per dl, it rises to 400 to 800 milligrams per dl. Next, what happens? Next we'll talk about what happens to the ESR. So the ESR is increased to 4 folds. So this is in short all the hematological changes in pregnancy. The next changes we'll understand in the next subsequent videos. Till then, thank you so much.